Hello guys, today we are going to cover a topic that is super important, but I don't know why many people don't like to talk about it. They prefer to keep it to themselves. Anyways, I'm talking about piles or hemorrhoid. They mean the same thing. So, if you've ever felt itching or you notice blood after using the toilet or you are even feeling pain around your anus, then please don't go anywhere. This video is for you. Today you are going to learn what hemorrhoids are, their causes and symptoms that you should not ignore, then the prevention tips, because I must tell you it is very, very preventable if you don't want to experience it ever. I'll also tell you what you need to do at home in order to manage it in case you already have it. We'll discuss other treatment options and also the red flag that you need to notice, because once you see this red flag, I beg you need to go and see a doctor as fast as possible. So let's get into it. What are hemorrhoids? Hemorrhoids are swollen blood vessels either inside or around the anus and lower rectum. Let's just think of it like lumps, something like bulging veins that comes out around the anus or inside. It can either happen internally or externally, depending. And they are usually caused by pressure, when there's too much pressure in that area. So let's talk about the causes. Where do they come from? First of all, when you are straining too hard in the toilet, like that moment when you are in the toilet and you have to push hard, like widen your eyes like this before that poop comes out. You know, those kind of hard poop. Exactly. And what do you notice after you've done that? You will notice that the surroundings of your anus is like peppering you. You feel that kind of burning sensation. Two, when you sit too long on the toilet, like many people have turned toilet time to their scrolling time. They just like to take phone into the toilet. Fola, why do you like to carry your phone along with you to the toilet? You just need to drop that habit. Like toilet time shouldn't take you maximum 10 minutes. You should be done. The longer you stay in the toilet, the higher the chance of having hemorrhoids. Three, low fiber rich diets. If you don't take foods that are high in fiber enough, then you're at risk of being constipated. There will not be easy or smooth movement of bowel content. Thereby, there will not be easy passage of poop. Then pregnancy. Yes, pregnancy due to the pressure from the baby. Heavy lifting also. When you're carrying something heavy, something weighty, it can result to heat. If you are also overweight or you are not active enough, it can result. Basically, anything that puts pressure in your lower rectum can make you be at risk of having piles. Let's discuss the types of hemorrhoids and their symptoms. Basically, we have three main types of hemorrhoids and each of them have their own different signs. First of all, we have the internal hemorrhoids. This one is located inside the rectum. It is usually painless, but after passing poop, you might see a bright red blood. Yes, and sometimes it may prolapse. That is, it can stick out of your anus and cause discomfort, cause pain, or irritation. Two, we have the external hemorrhoids. This one is usually found under the skin around the anus. It can cause pain, itching, swelling, and sometimes it can cause bleeding. Three, thrombosed hemorrhoids. This one is a more severe type of the external hemorrhoids. Usually a blood clot forms and thereby causing an intense pain, swelling, and possibly a hard lump can form. So let me tell you 8 things that you should do if you have hemorrhoids or you want to prevent it. Yes, just do these things. Firstly, drink plenty of fluids, water. Drink enough water. Make sure you are not dehydrated. Then two, eat lots of fibers, fiber-rich food, veggies, fruits, beans, oats, okra, even unripe plantain. They are very good source of fiber. Then three, make sure you take warm bath. Warm bath. This one will help to, reduce pain, reduce itching. Four, apply ice packs. If you have hemorrhoids already, just wrap ice in a towel, then apply it. This one will reduce swelling. Then five, use gentle toilet paper. Damp the toilet paper in water and use it to clean gently. Or better still, just rinse with water. It's not something you'll be scrubbing. Just do it gently. Six, always keep the area clean and dry because moisture can cause infection. It can delay healing. Then seven, make sure that you exercise regularly because movement alone prevents constipation. The more you move, the more you are facilitating bowel movement. And then lastly, Avoid alcohol and caffeine. They can dehydrate you and worsen constipation. So you want to avoid alcohol. Also, there are 6 things that you must avoid if you don't want to worsen your piles. First of all, don't strain too hard in the toilet. Beg. The moment you notice that poop is not forthcoming, like you have to ride in and give it full force, just stand up, okay? Stand up, go and get water and drink enough water, exercise, move up, down, up, down. All this one will facilitate easy bowel movements. Instead of staying on toilet seats and forcing yourself, you are not helping matters, you are making things worse. So just stand up and go and do something. 2, don't ignore the urge to poo. The moment you feel like pooing, just go straight to the toilet and poo. Because the more you delay your poo, the higher the chance of being constipated. 3, avoid wiping too hard. You don't have to scrub because it irritates the area more. So just do it gently, pat gently, rinse gently, and pat dry. By doing this, you are facilitating healing. 4, don't spend too long on the toilet seat. Just keep it quick. Maximum 10 minutes, you're done. You don't have to go with your phone and start scrolling. That should not be the moment when you enjoy playing anything on your phone. Just get it done and get out of the toilet. 5, avoid codeine-based painkillers. Whenever you want to get a painkiller, just check the label. Make sure they are not codeine-based because they can cause constipation. 6, avoid ibuprofen if you are bleeding because this may worsen the bleeding. And for home treatment and medications, pharmacies can help you with creams and ointments just to relieve the pain and itching. Then you can get cold packs for temporary relief, and also laxative just to soften your stool so that it can be easy for you to pass stool. Now, there's some period of time whereby you just need to go and see a doctor. You don't need to waste your time. Just go straight to the hospital. First of all, if you notice that the pain did not stop, like the pain is very severe, unbearable, go and see the doctor. If you are bleeding and that bleeding doesn't stop, like it's getting worse. If you keep getting piles, if these hemorrhoids keep coming as you are treating it, another one come. Abeg, go and see the doctor. If you have fever or chills or pulse coming out, just go straight to the hospital. And if you notice that you are losing weight without trying nothing, why are you losing weight? Go straight to the hospital. If you also notice something unusual around your anus, something that you've not seen before, or you cannot even explain what it is, just go straight to the hospital. If you notice that after 7 days, that home treatment doesn't work, nothing changes, just go straight to the hospital because your doctor will help you examine the area or perform a simple rectal examination. And lastly, if you are passing a large blood clot, then emergency. And as for hospital treatment options, if home treatment doesn't work out, you don't need to panic. There are many simple procedures that can be done in order to make things turn out well. There are non-surgical options and there are surgical options. One of the non-surgical options is rubber band ligation. That is, they will tie a band around the hemorrhoid just to cut off the blood supply to it. 2, sclerotherapy. That is, injecting a liquid into the hemorrhoid so as to shrink it. 3, infrared coagulation, that is the use of heat in order to destroy the tissue. 4, electrotherapy. Don't be scared. It is just the use of mild electric current to shrink the hemorrhoid. Most of these procedures are very simple and quick, so you don't need to stay overnight in the hospital. And for surgical options, if other treatment fails, then your doctor may recommend that you remove the hemorrhoid surgically. And this is safe and effective when done by a specialist. So there's nothing to worry about. So, have you ever dealt with hemorrhoids? Because I know this condition is very, very common. You must have experienced it maybe once or twice or even more. So tell me in the comments, what do you do to relieve your symptoms? What are the things that you've been doing to manage it? Because I know all along you've been keeping it to yourself. You don't want Anyways, let me know in the comments. And if you gain a value, of course you gain a value, hit the like button, subscribe to the channel to support me, and please, as usual, please send this video to your friends and family. Let them be aware of what hemorrhoids actually is and what they can do to save themselves. So be a savior rather. Don't keep it to yourself. Don't keep, at least if you are keeping hemorrhoids to yourself, don't keep this video to yourself. I beg you. And until next time, I'll see you when I see you. And don't forget, your health is my mission. So please keep thriving.